We're back to part 2 of menopause. And just before you scroll away, remember that word menopause starts with men. So this video is not only for women, it's also for men, because although menopause affects women, it doesn't directly affect men. And so in the part 1, we looked at definition of menopause, we looked at why menopause occurs, we looked at perimenopause and the symptoms. And so what can we do about menopause? Are women just going to be left alone and no help, no resolution of these symptoms? There are treatment modalities that can be engaged, and so I'll look at these. Number 1, local. Number 2, systemic, and then general measures. And so we're looking at part 2, and then in the part 3, we'll focus on some specific, what to do about some specific aspects. So 2 aspects in terms of treatment: to reduce symptoms and then to prevent bone loss. So we start with local measures that can be used. One of the symptoms I mentioned was dryness in the lower genital tract. What can be done about this would be, number 1, use of moisturizers and lubricants, and then estrogen creams can also be used. So moisturizers, lubricants, and estrogen creams can be used as for dryness of the lower genital tract. And then in terms of systemic treatment, the cornerstone is hormone replacement therapy, HRT, hormone replacement therapy. We categorize this use in terms of, number 1, those without a womb, and then those with a womb. And just in case you're asking, are there women without a womb? Yes. And there may be reasons why that could have occurred. Number 1, could have been from surgery, where the uterus is the medical name for womb, where the uterus had to be taken away. So there are women without a womb, and then those with a womb. Now, those without a womb can be given estrogen. Those with a womb will have to be given estrogen and progestogen. I explain why. For those without a womb, when you give the estrogen, there is no uterus, there's no womb, so that's fine. But if you give a woman that has a womb only estrogen, over time, the endometrial wall, that's the inner part of the uterus or the womb, gradually thickens and could predispose them to developing cancer. And so if a woman has a womb, she's given both estrogen and progestogen, somewhat acting as to counteract the effects of the estrogen. So the hormone replacement therapy can be given as a patch, and this could be effective for the hot flashes I mentioned as one of the symptoms. Hormone replacement therapy can also prevent osteoporosis, which is reduced density of the bone, which leads to fractures. And for women that have reduced libido, they could add on testosterone. Now, as helpful as these hormonal therapies could be, there are also side effects or drawbacks that we need to be aware of. When used, hormone replacement therapy can result in an increased risk of strokes, blood clots. And then for testosterone, there could be hair growth and acne if used in excess. So as helpful as these could be, they may also have their own problems. There are other medications that could be used, such as SEMS. I don't expect that you would necessarily need to memorize or keep this in your mind, but then there are medications that could be used. SEMS is selective estrogen receptor modulators, then SSRIs, selective serotonin reuptake inhibitors, and then SNRI, which is serotonin and norepinephrine reuptake inhibitors. These are medications that could also be used. And then in terms of the general measures could mean lifestyle changes. Usually in medicine, you would hear, number 1, eating well, which is a balanced diet, and then number 2, exercise. In terms of what to eat, it needs to be foods that are rich in calcium, such as milk, yogurt, and kale. And then in terms of exercise, it's not every exercise. Of course, exercise will generally be helpful, but the type of exercise that will be particularly helpful will be exercises where your feet and legs support your weight. We call them weight-bearing exercise. For example, walking. Simply walking a distance. But please, before you get engaged in certain forms of exercise, it's important that you speak with your doctor to ascertain how healthy you are to engage in that type of exercise. But in terms of weight-bearing exercise, we're looking at particularly walking, running, and dancing. So it's important that you speak to your doctor before you engage in exercise. And then it's also important to mention that one of the problems that occurs in menopause is what? Weight gain. And so if you're eating well, you're exercising rightly, it will result in weight loss. And then adequate sleep, meditation. And then it could also be helpful to talk to other people experiencing similar symptoms or be referred for talking therapy or cognitive behavioral therapy. You may also require counseling, and very importantly, if you do smoke, stop smoking. And so we've looked at local measures, we've looked at general measures, and we looked at systemic measures. If you do these, you most likely will be able to help go through the period of menopause. So in this part 2, we've looked at how to treat menopause, and then in part 3, we'll focus on very specific things you could do about specific aspects of menopause. Thank you.